see everyone here today. My name is Tom Freeze. I'm the co-director of the UCLA Integrated Substance Abuse Program, and it's my pleasure to kick off our conference for this year by introducing our Dr. Curley from the Department of Mental Health. Dr. Bond is Chief Medical Officer for the Los Angeles County Department of Mental Health. Prior to his appointment there, he served as Chief Medical Officer for LA County DMH. Dr. Bond served as Medical Director of D.D. Hirsch Mental Health Services, and he's had key roles in clinical leadership at Charles Drew University and the David Geffen School of Medicine at UCLA. He holds faculty appointments as Health Sciences Clinical Professor at UCLA and Professor and Chair of Psychiatry at Charles Drew University. The rest of his bio is in your program. Let me just say it's an honor to meet him and it's an honor to have him here. And let's welcome him up so he can open the platform.
Thank you, Tom. Good morning, everybody. Okay, I'm from a family of Southern preachers. Y'all can do better than that. Good morning, everybody.
Good morning.
All right, so I'm Curley Bonds, and it's a pleasure and an honor to be here to reunite with so many friends and colleagues from different stages of my career. But it's also important for us to be here to pay attention to a topic that's so needed: integrated care. So this statewide conference on integrating substance use, mental health, and primary care is pivotal. And imagine for a moment that today we're all going to be going on a journey. And let me talk about that for a moment. This room is going to be transformed into a gigantic vehicle that will allow us to make several different stop points, and each stopping point will allow us to have an opportunity to learn. And the best practices in this field will be brought to light. And at each intersection, we'll have an opportunity to network with colleagues, to talk about what our challenges and what our successes are. The best practices in providing care for substance use, mental health, and physical health problems. As a former consultation liaison psychiatrist, that's a branch of psychiatry that deals with the intersection between medical and mental health care, I know full well that people are complex, as are the systems that they get treatment in. And to bring all this together is really important. A few fun facts about you and your fellow travelers. Today, tickets were sold out well in advance for this conference. We have over 1,000 people in the room registered, and some that joined us today. There are 33 different California counties represented and 13 states. People have traveled even from other countries, including American Samoa and Guam. A variety of disciplines are also represented. We have continuing education credits and CMEs for over 500 licensed therapists, social workers, counselors, and SUD counselors. 75 physicians, 60 nurses, and 70 psychologists. There are also among our ranks pharmacists, physical therapists, and registered dietitians. And one group that didn't appear on my list, but that is critically important to the work that we do, are those with lived experience. Where are my peers? Hey, we need to hear their voices, because they're the ones who started us, I think, on this journey of integration and knowing that we need to take care of the whole person. Our goals for this trip are simple, but require us to work and buckle up. So put your tray tables down, get ready to write, and think. We want to amplify the ability for our community providers to be able to provide comprehensive, holistic healthcare services that will allow people to stay out of institutions like hospitals and the jail, to remain in community with the people that they care about, to give them purpose, and to be engaged in activities that enhance their well-being. We know that we have enormous challenges in 2019. Our county of over 10 million people has about 250,000 a year that seek services through our department. In order to address the challenges of homelessness, incarceration of those with mental illness, and a child welfare system that is extremely overburdened. This list goes on and on. And at the epicenter of all of these problems are the players that are very familiar with untreated addictions, poorly engaged people and families, and for us, we know that today will be a day that will help to find our way, to find the way to hope. But today is also a day that will help us to be on the national stage of integrated care with people like Ron Mandershield to help us in the field and hear about the state of the field. We'll also talk about the complex and difficult topics like moral injury and the ethno-cultural aspects of care. I want to recognize the members of the organizing committee and the team at UCLA and ISAP for putting this all together for a remarkable program. Would they please stand up for a moment? And also, I applaud all of you for taking time out of your busy schedules to join us on this journey. Safe travels. Next, it's my pleasure to be able to introduce the Director of Population Health Management of the LA County Department of Health Services, Dr. Nina Park. Dr. Park is a physician leader in the Los Angeles County Department of Health Services. She brings extensive experience in building sustainable and coordinated care models with a deep understanding of the DHS patient population. In September 2018, Dr. Park transitioned to a system-wide role as the DHS Director of Population Health Management, or PHM. The DHS mission is to deliver exceptional holistic care to DHS impaneled populations to ultimately improve their health and well-being. One of the key focus areas for the PHM team currently is integration of behavioral health in primary care settings, as well as building capacity to coordinate various social support services to be made available to patients. Previously, Dr. Park served for several years as the DHS Ambulatory Care Network Chief Executive Officer and Chief Medical Officer, and was a key architect in envisioning the significant changes in clinical processes undertaken by the department as it prepared to meet new mandates under health reform. She led the primary care transformation by implementation of patient empowerment, formation of patient-centered medical homes that are now NCQA recognized, and acquisition and adoption of a population health management platform, Empowered Life Management, registries, care management, and analytics. Prior to her appointment, Dr. Park spent 15 years in leadership capacities at Olive View UCLA Medical Center and its affiliated clusters and centers. Please put your hands together and a warm welcome for Dr. Park.
Good morning, everybody. Good morning. Thank you. I just realized that my little welcome speech is going to be shorter than my introduction. I don't have a prepared speech for you all, but I am here on behalf of the Department of Health Services and our Director, Christina Gali, who was unable to be here. She's actually at a groundbreaking event down at MLK Outpatient Center location where they are doing the groundbreaking for a new building for integrated behavioral health. So, you know, she's away, she's down south, but she's really thinking about the topic that you guys are all going to be discussing in the next 2 days. And I'm also excited to hear that we have quite a few physicians here today. I think it's great. I think we need to have additional physicians, especially the primary care providers, join this conversation. You know, I think they're a critical part of this journey and the transformation that we need to make to take care of our patients in a holistic manner. I'm really excited because 2 weeks ago, the Board of Supervisors actually approved a package. It was a huge package of increased staffing in the primary care clinics within DHS. We now have, we're now able to hire additional staff members that are going to be providing behavioral health services to our patients right in their primary care clinic. So we're really excited about that. And if I could speak as a primary care provider myself, I do see patients in one of our DHS clinics up in San Fernando. And for many, many years, a lot of the primary care providers had a hard time in dealing with patients that they understood had other issues separate from their physical health issues such as diabetes and hypertension. They sense that the patient might be depressed. They sense that the patient might be using substance. But many of us basically, try to ignore that, right? And the reason is because they felt that they had no resources, they had no connections. How would I provide help to these patients if I were to screen for those issues and we actually identify that they have a need that they actually felt like they didn't have the resources to fulfill. So this is a really exciting day. I think we're making a lot of progress to actually allow the patient to receive the services that they need. And more importantly, providing our team members the tools so that they can navigate through the system and actually get the patient to where the services are. So I'm really excited, and I welcome you once again, and I hope you have a very meaningful 2 days of sharing and collaboration and inspiration. Thank you. And I'm supposed to introduce Michelle Gibson from Public Health.
Good morning, everybody. Welcome to the conference today. I am here. My name is Michelle Gibson. I am the Deputy Division Director for Treatment Services at the Department of Public Health, Substance Abuse Prevention and Control. Unfortunately, Dr. Barbara Ferrer, our Director of Public Health, was not able to be here today, so I'm here on her behalf. Just to give you a little bit about myself, since I didn't have a bio today, like I mentioned, I've been with the county for quite some time and had the opportunity and pleasure to work with a variety of our providers in prevention services, youth services, and then more recently in strategic planning and marketing our new benefit package. Prior to that, I also was a program administrator for co-occurring disorder residential and outpatient programs in Northern California. So it's been a great opportunity to work in this field. And so with that, I wanted to again welcome everyone here today. This is a great opportunity for all of us to get together and really talk about integrated care from a substance use, mental health, and primary care perspective. And a great opportunity for us to work best with our patients in order to improve outcomes for them. So the Department of Public Health is a very proud sponsor of this event, which incorporates discussions to educate and challenge each of us to expand the ways that we apply our work and the way that we serve. This year's theme of enhancing foundations to change inherently reflects what we at the department have been doing in partnership with our network providers in implementing the Drug Medi-Cal Organized Delivery System waiver and the expansion of substance use disorder services. We are now in year 3. It's been a great and challenging opportunity for us to implement this opportunity, as our providers are well aware. And I think through this work, we've realized the importance of relying on fresh ideas, pilots, and engagement at all levels to help push our specialty SUD system forward and to move into greater partnership with mental health and primary care services, particularly for those who are in need of prevention and treatment services. So we wanted to also highlight a couple of opportunities as we move both the treatment system forward as well as our prevention services forward. In that effort, we really want to create opportunities to link individuals to services. We're doing that through a new partnership with the Department of Public Health's public health clinics, through our Connecting to Opportunities for Recovery and Engagement centers. Those are going to be spaces where the community can come and learn about substance use issues, learn about how to refer individuals for services, and really just to try and work towards destigmatizing substance use disorders more broadly in the community. We're also really excited to launch 50 student well-being centers within high schools across Los Angeles County that are going to serve as places where young people can learn about various health conditions, as well as really take an opportunity to develop their own skills through youth leadership opportunities. This is going to be a great partnership that we have both with the Los Angeles Unified School District as well as various other school districts across the county. We've also had opportunities to really try and work with the public, educate the public around various media campaigns. We've worked on marijuana issues, opioid issues as well, and I think it's part of a greater effort for us to really trying to incorporate substance use services more broadly within the continuum of care. So we wanted to, again, thank you for attending this year's conference and strongly encourage you to take advantage of the various thematic tracks that we have here to better address how to serve individuals from various vulnerable populations and through various communities across the county. The Department of Public Health and Substance Abuse Prevention and Control look forward to working with each of you to increase access to services that are linguistically and developmentally appropriate, as well as demonstrate cultural humility in order for us to serve the populations, the very populations across the county. I think this conference is a great opportunity for us to both learn and to partner with others. And so with that, I want to again thank you for your attendance and hope you have a wonderful time at this event.
Thank you very much, and it's nice to have that welcome from all of our sponsors. Can we give our sponsors another round of applause, please? Just to understand our role, as the co-director of UCLA ISAP, the Integrated Substance Abuse Programs, we received a contract from the Department of Mental Health to be the administrative host for this meeting on their behalf of all of the sponsors. Al Hassan, who I'll introduce in just a second, and I co-chair the conference planning committee, and I want to add my thanks to that committee for what has turned out to be one of the most exciting agendas that we've had. I think I say that every single year, and every year somehow we top ourselves again, and I think the agenda is really stellar this year. And I've heard several people going, I can't choose, I don't know what to go to, and that's a problem I'd love for you to have. So thanks again to LA County Department of Mental Health, LA County Department of Public Health, Substance Abuse Prevention and Control, LA County Department of Health Services. This is also done in conjunction with our group at UCLA, with Social Model Recovery Systems, who once again provided all of the funding for the conference bags. Can we give them a round of applause as well? And a lot of the information that's been gathered has been gathered from the Pacific Southwest Addiction Technology Transfer Center, and we hope you make use of all of that information. In addition to the conference planning committee, we have an army of volunteers who help us with this meeting. And first of all, we have a large group of people from the Department of Mental Health who volunteer to help us manage the workshops and make sure you get the continuing education that you need. So can I have our DMH volunteers, if you're in the room, stand up, please? And we also have about 30 people from UCLA Integrated Substance Abuse Programs who aren't directly affiliated with the conference planning, but volunteer their time as well to make sure the registration process goes as smooth as it can, and that we take care of all of your needs on an ongoing basis. So if any of the ISAP people are in the room, can you stand up as well? Most importantly, I'd like to acknowledge Al Hassan, Al will stand, and Shannon Martia, she's in the room, who are this entire conference. And their hands and their sweat have gone a lot into making the conference happen today. We are able to offer continuing education for most of the disciplines represented. If you are, by the way, LA County